Okay, good morning everyone. So today we'll be launching our whiteboard. The whiteboard is a way for us to track our patients here in medical ward. It all started with ER, their whiteboard. They're able to track how long their patients are in ER. And for the wards, it is the first for us. No other wards have the whiteboard. So the whiteboard will be seen in all of our desktops, including the desktops in the doctor's room. So this is the icon, the patient visit. So this is the home page, and you have your, and then just click open, ER whiteboard. It will show you all of the patients in ER, and once your patient is admitted to the wards, it will be transferred to the whiteboard of medical ward. So to go to the whiteboard of medical ward, you just go back to the home page, and then go to inpatient ward and go to medical ward. So I was able to upload everybody in the whiteboard. So this is our list of patients on the floor today. So you have your option to view it. You have your filter here. You can put by the doctor. It will show the doctor's patients accordingly, and then, or if you want, the nurse. Okay, and you can also view according to location. So automatically from ER, it will be transferred here. But if the patient is from OR and the clinic, we have to upload it manually. Okay. So the only thing that we need to do when the patient comes is to identify who the nurse is, who will be handling the patient. We have all the list of the patients here, of the nurses' names here. And then you can change that. Just click your name, and it will automatically change to the nurse's name. And we also have the doctor, because from ER, that space will be blank, and you have to identify who's the doctor handling the patient. And just click X there. And then for the team, because we have patients from other departments, you can also change it. You have your options, and you can change it to surgical if it's a surgical patient. You have options for ENT and the clinic, medical, OB, peds, and surgical. And just tick the checkbox. And then the diagnosis, it will be what they loaded in ER, it will automatically appear on this field. Okay. So the responsibility of the nurse in charge will be to identify if the patient is a risk for fall. Just click the box. You have two options, not at risk and high risk for fall, as well as the pressure ulcer. If patient is not a high risk of pressure injury, just click that. There's no check on the box, but if a patient is a high risk for pressure injury, just click. So that's the responsibility of the nurse in charge. So the one thing that we have to coordinate with our doctors is the expected discharge date. So the nurses in charge today, if you can ask the doctors for their expected discharge date. This is one of the things that they'll be discussing during the meeting, if we are ready to discharge the patient according to the expected discharge date. So it is the doctors who will be giving you this information. So the next part will be the ones will be able to track for the delay of care. So for example, your patient needs blood. You have to just take blood required, and it's still X because it's still not done. So if it is completed, you have to check the blood cell. Okay. So in a way, we'll be able to know if it's done or not, if it's ordered, and then we have to make sure that it's done. So it's important we do it on a timely manner, because when we generate the report and we'll see that if the things are delayed, we have to look through into it why it's being delayed. And these are the things that we have. If there's an X-ray, then take the X-ray box. And once it's done, make sure it's completed. And once the patient is for discharge, we have the box to discharge the patient from the system. But there's a pop-up. Make sure that you're sure that you're discharging the patient. Is the patient leaving the ward? Yes. And it will give you an option. It's either you have these 5 options: deceased, admit to a different ward, probably ICU, or back to surgical ward, discharge home, left AMA, and left without being seen. So if the patient is being transferred to the ward, it will give you an option to wear, because in the future there will be also a whiteboard for all other wards. So it will, if you put an ICU, once it's clicked, the patient will be in the ICU whiteboard. But let's put an cancel on that. And there's some free text here if you have some important things that you want to be noted by, because everybody will see this, the social worker, PT, RT, dietitian. So if you have some notes for them, you can put in your, it's a free text. Okay. So the expectation is that we update it every shift and make sure done on a timely manner, especially when it comes to the procedures that needs to be done. Okay, all stations have the whiteboard, so make sure just if you are not able to update it, just let somebody know to tick the box for you. Okay, so today we're just expecting you to update the names and as well as the high risk and the pressure injuries. Okay, so moving forward, this will be used by everybody. So we'll be knowing the progress and why there's no progress in the patient's discharge. Okay, that's
So
it.
that's done every
Shift.
every shift.
Okay.
So we're continually editing that.
Yes, especially with the patient's assignment. So make sure you put your name there, but and then we'll change the discharge date or update the discharge date as necessary. Okay, that's it for today. Thank you.